How are you?
Super excited.
Nice.
Tired, but yes, it's been a wonderful 5 days.
Oh,
From
really?
last week Saturday.
Oh, right. You mentioned that you had a procedure,
Yep.
a groundbreaking breast reduction procedure,
5 hour surgery.
a 5-hour surgery. How did that go?
Well, I mean, I was too nervous. So
Oh, you still get nervous?
well, yeah, you still get nervous. It's always another human being, and I just like watching your child take their first steps.
Yeah.
You just want to see how everything goes. Although you're very confident about the team, they're all very experienced people, but it's machines. It's so many things can happen from the anesthesia to the surgery itself. Would you need blood later? Or no, this might. So yes, a bit nervous, but everything went smoothly, and patient is home right now. I'm sure she's listening to us right now.
Is it?
Yes.
Wow.
So,
Congratulations to her.
yes, for her courage, to do it. And I know she's going to put out her story, about, Kwame, we guys too, we just we don't think it's a problem, for a woman to have unusually big breasts. But the physical problems and the mental health problems that she went through, although I'm a physician and I sometimes know about it, I don't think I'd seen it at that level before.
Okay.
And the relief when she woke up and she was like, I feel 2.3 kilos lighter.
Wow.
And probably that's the amount of breast tissue that was removed. And
Wow.
and the artists did their work. The doctors, the plastic surgeons did a beautiful job, reshaping and redesigning everything. God is a master plastic surgeon.
I can imagine.
So
happy it all
kudos
went well.
to the entire team,
Yeah.
from everybody in the theater, the nurses, the scrub nurses, the circulating nurses, the people in the ICU, the post-operative care, Prince and the team at the inpatient unit who nursed her in the 2 or 3 days that she was with us, the anesthetist, everybody,
And she's already home.
Oh yeah, she's home.
She spent only 2 days.
Yeah, 3 days. I think she went home on the third day or so.
Wow.
The third day or
That's
so.
wonderful.
Yeah, so yeah,
that's wonderful. I'm happy. Congratulations to you guys. And I know a lot of people are listening who also wanted to take the step of the breast reduction surgery and whatnot. Well, medicals can take care of that for you.
Right.
So just reach out to Dr. Osafo. I know you guys are doing a lot of things. I heard about the corporate health literacy program.
Right.
What's that?
Yes, Kwame. So that's our latest package that we've rolled out. I think 2 weeks ago I heard Winston and the team talking about pre-hospital care on the Super Morning Show. Kwame, do you ever think about what will happen or what happens in the workplace if somebody just say passes out? More often than not, probably we just pour water on the person, smear some garlic on them, and then speak some tongues. And then everybody's running like headless chicken, not really knowing what to do. So we've decided as Medicals Hospital to approach a lot of these corporate organizations, to introduce to them our corporate health literacy program. One, to educate people on common health issues. Two, first aid. First aid is so important, but very few people know about it. Bandaging. If somebody falls, has a fracture, how do you carry that person out? And then basic life support.
Okay.
All these chest compressions, then the case of life, and all of those things.
CPR.
If somebody's cardiopulmonary resuscitation. If somebody's choking on food, what do you do? Somebody's having a seizure, what do you do? So this program will take us into the corporate offices, come to your offices, and then 30-45 minutes.
Okay.
And we expose you. We'll come along with our mannequins.
Okay.
These dummies that we use to show you how to position patients if somebody passes out, what to do.
Okay.
So it's all one big package, and we call it our health literacy program. So the corporate institutions who are listening, if you want us to come in and educate your staff and teach them a few very, very handy skills, well, you know what to do. Reach out to us.
Reach out to Medical Hospital ASAP.
Yeah.
Good stuff. I think you guys are innovating and I love it.
Thank you, Kwame.
Now let's talk about preconception care.
Yes. We've got a case, don't we?
One of our very good friends shared with us her issue, and I thought that you might want to speak to it. Her name is Ajwa. Ajwa says, I just turned 29 and I manage an eatery somewhere in East Legon Hills. I got married 2 years ago. At the time, I was pursuing a career change and I was therefore not ready for the baby conversation.
Right.
Now I'm settled and I raised the issue with my husband. His answer stunned me into disbelief. Go and see the doctor to make sure you are fine and then we can talk about it. I told him in a strong language that his behavior belongs to the Stone Age and that actually got us into a fight.
Oops.
I'm very sorry about my outburst, but I know that it takes two to make a baby. So I was expecting him to come along with me to go and talk to our family doctor about our intentions so we could receive the necessary counseling. He's adamant he's fine and can make a baby anytime. Lexis, kindly put my dilemma out to the drive doctor. I'm sure he can speak to the issue and how, and throw more light on our respective positions. Thank you.
Right.
That's Ajwa for you.
So that's Ajwa and a little domestic issue that needs arbitration.
It's nothing one case can solve.
You see, I'm wondering whether this thing happened before or after Valentine. Otherwise, Ajwa has to wait for next year. After. Right. So, this afternoon, Kwabe, I want to talk about preconception care. I know the beginning of the year on 31st night, there are a lot of resolutions, or the beginning of the year is when people take decisions about even starting a family. Everybody sets out their goals for the year. And I know for a lot of people who are listening, or for some people who are listening to us this afternoon, their goal this year was to make babies or to start a family in that regard. So, I'm not surprised by the response put out by Ajwa's hubby. Go and check, make sure everything is fine. Because Kwame, a few times that people come to us or come to be in the hospital for preconception care, it's always the woman. Yet to find a couple who would come, a man and a woman,
together
to say, okay, we want to start a family. So we're here to talk to you, to gain better insight about what all this is about. So,
why is that though?
Maybe we should open the phone lines because we try and get into their mind. But I think Ajwa gives us a bit of insight and says that the man says he can make a baby anytime. So in our mind, I think for a lot of people, it is the baby, the act of making the baby. For us, it is just straightforward and very, very simplistic. But as someone once told me, a baby, a child, bringing a child into this world is a 25-year prison sentence. Because it says you'll never be free for the next 25 years.
Yeah.
So it goes with a lot of responsibility. So during that period of the pregnancy or even trying, Kwame, I've seen marriages, break down because of infertility. So they're trying to get pregnant, getting pregnant, carrying that pregnancy for 9 months, labor, delivery, and raising that child is a big, big task. And it has so many bumps on that particular journey. And the whole preconception care idea is to make sure it's not about getting a woman pregnant. It's not about making a baby. It's about preparing the couple for that whole journey of making the baby or getting pregnant, carrying the pregnancy, labor, delivery, and the post-delivery issues. That is what preconception care is about. So preconception care is the provision of biomedical or medical, behavioral, and social interventions to women and to couples before conception occurs, to make sure that when it does occur, all the subsequent stages, we understand, or the couple understands what is going to happen. So, Kwame, let me share with you some facts about pregnancies and babies and all of that. 4 out of 10 women report that their pregnancies are unplanned.
Oh, yeah?
Mm-hmm.
4 out of 10?
Yes. I thought even this number is even too small.
Still conservative.
Oh, me, I think it's 8 out of 10. People get married, especially, and then as a matter of course, they think that they should get, like, everybody's expecting that they will have a baby.
Yeah.
But whether or not they wanted to have a baby this year, next year, no, it's not planned that way. They don't make a firm determination. And since they say they are idea,
yeah,
a bar, not bar. I think that's the mindset. But actually saying that this year or from June we'll start to try, I don't think a lot of people do that.
And
but
even with the number of children that they have to have, I think that maybe after 1, 2, someone might say, oh, well, I'm done. But before you realize, then
boom,
somebody is pregnant again.
Come the way you see somebody.
Yeah. Well, yeah.
Kwame, you absolutely nail it. The number of children not planned. So it's like we make up the rules as we go along.
Yeah.
Okay. The way I suffered with this third pregnancy or this second pregnancy, no, then I won't have another baby. So it's almost like that. So WHO is saying 4 out of 10 women report that their pregnancies are unplanned. 2, perinatal deaths are 50% higher among babies born to adolescent mothers.
What's perinatal deaths?
I mean, death that happens just around the time the baby is born.
Okay.
So usually around the first 28 days, you deliver and then the baby dies. So 50% higher among babies born to adolescent mothers. So Kwame, what does that tell us? If we want to reduce the risk of these perinatal deaths, then we have to try and discourage teenagers becoming mothers, with all the attendant risk. Again, up to 10% of pregnancies among women with untreated gonococcal infections result in perinatal death. So the risk of sexually transmitted infections, and I think most people know about gonorrhea, that if it is untreated, then up to 10% of the pregnancies in there will result in the babies or the mothers losing the babies. Maternal undernutrition and iron deficiency anemia account for at least 20% of maternal mortality. A lot of the maternal deaths, women who die from pregnancy and pregnancy related causes, die because of something we call PPH, postpartum hemorrhage. They bleed immediately after birth, and a lot of it is connected to their iron levels. And a lot of their low iron levels is happening because of malnutrition or undernutrition during the pregnancy. Lastly, in the absence of interventions, rates of HIV transmission from mother to child are between 15 and 45%. So, why am I throwing all these different statistics to you? We're going to talk about preconception care, and we are going to see all the different areas that are covered during preconception care. And you'd realize that these different medical, behavioral, and social interventions go a long way to reduce all of these things. Right, so Kwame, the aim of all this preconception care, what are we trying to achieve? Well, we're trying to improve the health status of the individual or the couples, and also reducing behaviors and also environmental factors that can contribute to poor maternal health and poor child health outcomes. So that's the whole aim. We want to improve the health status, and also want to reduce certain behaviors and also deal with certain environmental factors that will all compromise the health of the mother and then the baby. Well, there are the different areas that are addressed during preconception care. So when a couple comes, what are we going to do? Well, Kwame, the first thing, or one of the things that we do, the first area I want to touch on, nutritional conditions or nutrition care. Kwame, it's very, very important. And we always talk about the mother eating for two.
Right.
Right. Well, Kwame, who are the people who bring the chop money? So Ghana still, even the women who have good jobs, the better jobs, paying jobs than the men, they still expect the man to bring chop money. Right. So this is why it's important the man must be in there to listen to the conversation. Don't come, stay at home, and then when the woman comes back and says that, doctor say, there is yeah.
Now you chop money.
Now you chop money, please. The chop money now, it has to be deep. The pockets, you have to deep in the pocket. So nutritional care or nutritional consideration is very, very, very important. And you must understand this particular conversation before you get pregnant. It is very, very important. There's some important deformities or problems that occur in the fetus that occur in the first 6 weeks. Neural tube defects that affect the spine development, and it happens in the first 6 weeks. But a lot of Ghanaians would come to the hospital somewhere around the 7th, 8th week at best. Those who come to hospital early. So by the time they get to know they're pregnant, that time has passed. So folic acid is one of those nutritional deficiencies that we see. So we're going to do screening for anemia. We're going to even do supplementation with iron and folic acid if appropriate. Because remember the earlier statistics I talked about, maternal undernutrition and iron deficiency anemia accounting for 20% of maternal mortality. So we will do nutrition counseling and do screening for iron and folic acid deficiencies. Then we'll also try and address some nutritional taboos.
Okay.
Yes.
Taboos?
Yes. Because when you say a pregnant woman shouldn't eat egg, the child will be a thief. And things like that. So we try and address some of the nutritional, taboos. There would also be things like pica, which is a certain desire for eating non-food items. This is they call shile. Yeah. It's clear, right?
Yeah.
So you get these cravings for non-food items. Ice block. Instead of eating real food. So we will talk about all these things as possibilities if you get pregnant. Number 2, after we're done with the nutritional conditions, we'll talk about genetic conditions, or we'll do genetic screening and genetic counseling. Kwame, there's a saying that everybody comes from a family. All right, that means that genes are inherited, they're passed on from one person to the other, and therefore a thorough family history is very, very important. And I keep mentioning this. We need to know more about our family medical history. Too many times I ask people and they say, "Oh, me the Arabian." I said, "Come on." It's not as if this is a curse or anything. Every family, there are medical conditions. So quit saying that in your family you don't have any medical conditions. But let's also be very open. Let's try and share within the family, because things are passed on. Medical conditions are passed on. So during the genetic counseling bit of the preconception care, we take a thorough family history, and that's why again we need the couple, we need the man. Your wife wouldn't know about your family, your uncle, great uncle, and all of those things. Right. Your wife may not be familiar with all of that. Then we will also screen for one of the most common genetic conditions in this country, sickle cell anemia. All right, sickle cell anemia, very, very common. So we will look out for that and whether or not it is something that you are at risk of passing on to that baby that you want to make. And then you fully understand the risk factors or the risk that you are taking. If you decide, for example, what is AS, another is AS, is it a risk that you want to take? So genetic conditions or genetic counseling. We would also talk to the couple about infertility. Most of the time, Kwabi, you wouldn't know that you have any fertility challenges because you've never tried making a baby. So that is a real possibility, and we'll begin to address it. Kwabi, the medical definition we have for infertility, we're not going to investigate anybody until 12 months of what? Unprotected, regular sexual, and when we talk about sex here, we're talking about penovaginal sex. All right? It must be unprotected, it must be regular. For a period of 12 months at least.
How regular is regular?
Kwame. Regular is okay. You regular no pay number be three
3 times a day?
A week.
Okay.
Why? I want to go to work.
Sorry.
Kwame.
Before work, after work,
and
then in the middle of the night.
Right, so we would say that 3 times in a week if you want it. So we will have a comprehensive conversation about infertility. Again, it's a conversation that most men equate the ability to have an erection to being able to make a woman pregnant. No. We will look at male infertility, we'll look at female infertility, and we'll discuss the factors that may contribute, to that. So that's always a very, very exciting conversation that we have. We would also look at sexually transmitted infections. But the moment anybody gets pregnant, it means they've had unprotected sex. And unprotected sex comes with dangers. All right? So that's why part of the thing that we do when you actually get pregnant and you start the antenatal clinics is for us to check for HIV, hepatitis B, syphilis, and so on and so forth. So we do all of those things. All right. So we'll have a good conversation about sexually transmitted infections and also what constitutes safe sex. And Kwame, as well, we will blend it in with the question you asked. How often should we have sex if we are not using it for entertainment, but we want to make babies for procreation? Because the two are not the same.
Okay.
Right. Next, we also want to talk about interpersonal violence and then mental health. Kwame, I place the two together. Pregnancy is a very, very stressful situation for women in particular. I mean, let's be honest, it's a woman who's carrying a baby. Let's be straight at it. The men, we don't suffer any physiological changes, very little. I mean, emotionally, you can be stressed, that whole pressure of going to become a father and all of that. But it's the woman. And Kwame, if you layer on top of that, giddy in the house, and actually physical violence that some women actually have to suffer. So we make it a point to talk about interpersonal violence, and it doesn't always have to be physical violence, but mental, verbal abuse and all of that. We will try and get the couple to understand that this is not the time, or as much as possible, but this is the time you have to, pamper the woman and make sure that she's in the best mental state, during the 9 months. So we address that. Next, we try and address the use of psychoactive or substances of abuse. The most abused substance in Ghana and globally is alcohol. So I don't want people to think far that we're talking about something big. No, we're talking about alcohol. All right? Alcohol use. I always say it's a no. Women in the reproductive age group, I say don't drink. Because except those who are taking absolute precautions using family planning methods, you never know when you'll be pregnant. And if alcohol is on board the day you become pregnant, the changes start already before you realize that, oh no, I'm 8 weeks pregnant, so I've stopped drinking. A lot of the changes have happened. And alcohol has such a terrible, terrible effect on the brain of the developing fetus. So there's something we call the fetal alcohol syndrome, and we'll probably get into that another time. So it's a strong push from me that women of the reproductive age group don't do alcohol, don't do wine, don't do beer. You have your children. When you finish having your children, you can join Philip and the team, and you can do your thing. Right. Lastly, we talk about vaccine preventable diseases. All right. Kwame, Ghana got one of the best vaccination programs globally. That's one of the things that we do, and we do very well. Now, I can say we'll start manufacturing the vaccines here so that we don't have to depend on outside when it comes to our cold chain program and all of that. So this childhood killer diseases and all of that, we have very high vaccination coverage rates.
Hopefully, USA doesn't affect it.
I'm in this tree. I don't have to talk about Trump's matter before when I go for my visa application, because next year I'm trying to see whether I can go and visit Trump. So right now Trump man cannot say but he can buy this country before you know he's buying us. But that one wouldn't be bad. 52nd state. Anyway, so we'll talk about vaccine preventable diseases, because after you go through all this 9 months, the labor and all of that, then that child is born. We don't want the child to suffer from tuberculosis, polio, diphtheria, whooping cough, all of that. Okay. So we'll have conversations about that, so you know exactly what's going to happen, because one of the vaccines will be initial, actually 2 of them initiated on the day the child is born.
Okay.
So Kwame, these are the broad conversations, wide-ranging conversations we will have with the couple when they come in for the preconception care.
This is good. This is very good information, because I'm sure somebody's listening now and they're thinking about making babies and they would want to actually come over for this education. Obviously, it's not just for the woman, it's for the man as well.
Absolutely.
All right.
So Kwame, they can come over, number 10 Kincho Street, near School Junction, or you can reach us on 0501 477 337. Our WhatsApp number is 0501 477 340.
Dr. Yaw Osafo is the CEO of Medical's Hospital. Thank you, Doc.
You're welcome.
Girl, you make me wanna get you pregnant. Girl, you make me wanna get you pregnant.